The location of the points for tapping. The first and most important point is the side of the hand. This is also called the karate chop point because you could chop down to stimulate the point. The point is not the bone of the knuckle nor the wrist, it's the fleshy part that you would stimulate if you were doing a karate chop. So just tap lightly on a point there. The other points on the hands, if you hold your hand in a chop position, are on the tips and ends of the fingers. So the little finger or the tiny finger, the middle finger, and the index finger. The ring finger is the exception in that the point is on the back of the hand, in between the little finger knuckle and the ring finger knuckle in that groove there. This point's called the gamut spot. And part of the tapping protocol is the 9 gamut, which I'll demonstrate now. It's closing eyes, opening eyes, looking down one side, looking down the other side, rolling eyes in a circle one way, rolling eyes in a circle the other way, humming a few different notes, any notes or a tune, counting a few numbers, again any numbers, 8, 9, 10, and humming again. And that's the end of the 9 gamut. The other points are on the upper body. So there's the beginning of the eyebrow. So we can tap both points together here, like this, or just with one hand, or just with the other hand. It really doesn't matter how you stimulate the point. And again, the tapping's lightly and at least 5 times. It doesn't matter if you tap for longer. This is the stress point or the trauma point. Another point is on the outside edge of the eye. This is the point that's used for the emotion of anger and rage or frustration. It's also a good point for releasing tension, whether in the mind or in the body. All these points have emotions attached to them, and they're used in acupuncture and acupressure and Chinese medicine. This point is actually on the stomach meridian, and this connects with us when we feel a sense of worry or butterflies in the stomach or feeling of ungroundedness. It's a delicate point, so tap that one gently. Under the eye, that one is called. And then on the midline, we have under the nose and the middle of the chin. And those 2 points are the only points on the midline. All the other points are both sides of the body, one side or the other side. So coming down now to the collarbone point, if you find the V notch in your neck go down a couple of inches to the side, this point's below the collarbone and above the top rib. And if you tap like this, or with one hand, both points, really the accuracy, it's not like acupuncture where you've got to be completely exact. It's very forgiving. Just tapping here, you're going to cover the collarbone point. And lastly, there's a point under the arm, which is, rather than the armpit, just a handbreadth down under the arm there. So you could tap like this on that point. Or you could do both of them. That's one, other, or both. Thank you.